Hello, welcome friend. Welcome to our channel Quality Group. Friend, today our topic is media fill validation, a breach in sterility. A media fill, sometime known as process simulation, is the performance of an aseptic manufacturing procedure using a sterile microbiological growth medium in place of the drug solution. Microbiological growth medium is used in place of the drug solution during media fill to test whether the aseptic procedures are adequate to prevent contamination during actual drug production. A media fill is one part of the validation of an aseptic manufacturing processes. What is the media fill designated to evaluate? The media fill is designed to evaluate the aseptic assembly and operation of the critical, that is sterile equipment. It qualifies the operator, it assess their technique and demonstrate the environmental control are adequate to meet the basic requirement necessary to produce a sterile drug by aseptic processing. The media fill does not validate the ability of the filter to sterilize growth media. A media fill or aseptic process simulation, that is APS, is a critical validation test in sterile manufacturing where a sterile microbiological growth medium is used in place of drug product to ensure aseptic process is free of microbial contamination. It assesses the adequacy of aseptic procedure, equipment, and operator techniques by simulating a commercial batch under worst case condition with the filled container then incubated to detect microbial growth, which would indicate a breach in sterility. A media fill is a simulation of the aseptic manufacturing process. It uses a sterile, nutrient-rich microbiological growth medium instead of actual drug product. The goal is to evaluate the sterility of the aseptic process by seeing if any contamination occurred during the simulated fill. Media fill are essentially in the pharmaceutical, beverages and food industries where product require strict sterility. Why media fill is performed? To validate the aseptic process. It provide and prove that the aseptic procedures are capable of preventing contamination during sterile drug production. To qualify operator and equipment, it ensures that personnel are performing the correct aseptic techniques and that the equipment is operating correctly and it is sterile. To control environmental control, it demonstrates the manufacturing environment control are adequate to support aseptic processing. All steps intended for aseptic manufacturing should be reproduced in the media fill, including sampling and dilution of the final product. All personnel involved in the aseptic manufacture of the drug product should participate in at least one media fill per year. All processing steps that the operator normally perform during aseptic manufacturing should be simulated. The simulation process should duplicate the actual production process where the aseptic steps are conducted from the setup of the vial assembly to the transfer of the whole drug from the sterilizing filter into the final container that are ready for release. A connection to the container of sterile medium may be substituted in place of the filter. How does media fill work? Simulation. The test replicates the real-time aseptic manufacturing process, including filling and closing container worst case condition. The process is performed to mimic the most challenging condition a commercial batch might face, potentially including wider container or lower line spread speed to maximize exposure to the environment and human intervention. Incubation. After filling, the sealed container are incubated for a setup period. Often it is for 14 days at specific temperature, example 20 to 25 degrees Celsius and 30 to 35 degrees Celsius, to allow any microorganism to grow. The incubation period of a media fill should be not less than 14 days and the container should be examined every 2 to 3 days. Inspection. The container are then inspected for any sign of microbial growth. Outcome. If growth is detected, it signifies a failure in the aseptic process, indicating a need for investigation, corrective actions, and retraining. Reference Guideline USP Chapter 71 Sterility Tests for Appropriate Organism Selection. All steps in a media fill should be done in the same location as the drug production step. If the product container is filled within the hot cell, then the media fill should also be performed in the hot cell. If it is not filled in the hot cell, then the media fill does not need to be performed there either. The synthesis box is generally located upstream from the sterilizing filter and is not considered a sterile component or part of aseptic operation. In such cases, do not include the synthesis until in the simulations. Once the media fill procedure are established, all the components necessary for the simulation should be assembled, including all the equipment used in the aseptic part of the process. Media to be used in the simulation may be obtained commercially or prepared on site and should be sterile. When media are prepared on site, sterilization should be conducted using a validated process such as steam autoclave. Filtration is not recommended to sterilize the growth medium. How to choose the growth medium? The most commonly used growth medium is soybean casein digest medium, that is SCDM, which is commercially available under the various names such as trypticase soy broth. A recipe for this medium is found in USP. Recipe for SCDM in other pharmacopoeia may have slight variation from the USP but are acceptable. Other journal growth media are available, but their use may not be as practical and may require justification. Medium from a qualified commercial vendor may be facilitated for media fill. Shipping, storage, preparation, and handling procedures should be carefully designed, documented, and followed to ensure media integrity and stability. Commercially prepared media should be used within the label shelf life and stored according to the label recommendation. To initially qualify an aseptic process at a specific facility, 3 media fills should be conducted on 3 separate days at that facility using the specific production process that is being qualified. How 3 commercial available batches, lot or medium from a single supplier should be subject to quality control tests. These tests should include visual inspection, pH, sterility, and growth promotion. Result of this testing should conform to the result reported in the certificate of analysis. You can refer to USP for conduct of growth promotion test. Many vendors will have sample of different batches available for purchase and testing. If 3 different batches are not available initially, then it may be necessary to test each of the first 3 incoming batches for conformance to the COA. According to USP, SCDM should be sterilized, that is confirmed by incubating samples for 7 days at a defined control temperature, pH 7.3 plus minus 0.2, and able to permit growth of selected aerobic species, example Staphylococcus aureus, Bacillus subtilis, Pseudomonas aeruginosa. For media fill, use of only one species of bacteria is necessary. Once a media vendor is qualified, media qualification program should periodically verify the full COA and growth promotion capability to ensure continuing vendor reliability. Growth promotion testing. A growth promotion test ensures that the medium used in the media fill will support the growth of the contaminating organism. This is essential control for media fill because the desired test result is no growth, and only by demonstrating the medium's ability to support microbial growth can the negative result be relied upon. GPT should be performed on the growth medium used in the media fill. This may be performed by inoculating a portion of the batch within a small number less than 10 to power 2 of microorganisms to confirm the medium support growth. When the medium is prepared in-house at the site of drug manufacturer, a growth promotion test should be performed for each batch of medium prepared. Medium should be prepared using autoclave sterilization processing and not by sterilizing filtration. GPT and positive control growth promotion testing confirm the medium ability to support growth. GPT is commonly done before using the medium is an experiment. A positive control test the ability of the test method to result in a positive outcome is commonly done concurrently with an experiment. Media fill positive control show that the medium in the drug product container will support growth after exposure to the filling process. The positive control should be in a container filled as a part of media fill. The positive control test may serve as a growth promotion test for the medium as long as qualified vendor is being used. Key benefits of media fill validation: identify contamination risk. Media fill mimic the manufacturer environment with a medium to highlight potential source of contamination, ensuring aseptic process are robust enough to maintain sterility. Access operator performance: operator conduct the media fills simulation, allowing for the evaluation the qualification of their aseptic technique, gowning procedure, and the performance of intervention like equipment setup and line restart. Media fill validate the aseptic process. It verifies the effectiveness of the entire aseptic filling process, including critical equipment, environmental control, and the operational procedure to ensure consistent sterility assurance label. Media fill facilitate personal training. Media fill exercise provide hands-on training and experience for operators, helping to improve their skills in aseptic manufacturing and enabling targeted retraining if any failures occur. Ensure regulatory compliance. Media fill testing is a fundamental requirement for sterile pharmaceutical manufacturing and provide crucial documented evidence to regulators that the aseptic process is capable of producing sterile drug products. Media fill drive process improvement. The results from the media fill offer valuable data that support process optimization by revealing area needing improvement, leading to more reliable and contamination-free manufacturing operation. Simulate 4-case condition. Protocols are designed to include routine and non-routine events such as manual intervention, line restart, and extended hold time to assess the process performance under a challenging real-time scenario. Thanks a lot, and keep watching our channel. Like, comment, and subscribe more and more. Thank you.